In this part 2 out of 3 video series on testosterone in women, we're going to carry on the discussion about testing testosterone, how we should approach blood work, and what the optimal levels are. If you recall, and if you've seen in part 1, we discussed the causes of low testosterone in women as well as the symptoms of low testosterone in women, with a brief discussion around hypoactive sexual desire disorder. And now we're going to talk more about blood work and what can we do once we suspect someone has or a female has low testosterone levels. So as you recall, if you have the main symptoms of low energy with afternoon crashes, along with muscle wasting or inability to put on muscle mass, low libido or any sexually related issues or problems, that can indicate a low testosterone level. And so what should be done after that? Well, after that, there really should be a thorough workup. First of all, to exclude other things, because low energy and low mood, those types of things can be related to other issues. So you want to get a complete blood panel looking at your thyroid levels, looking at your iron levels, looking at your vitamin D levels, looking at other hormones as well. But as it pertains to testosterone, we primarily look at blood. Blood or serum is the best test for testosterone overall. We can also look at urine in something called like a dried urine test, if you're familiar with the Dutch test. So that's a dried urine test which shows you the levels of testosterone, DHEA, and so on. However, in this case, we are going to be talking about blood work because that's the easiest lab to run. It's often the least expensive and it's the most accurate. So we have to look at blood work pertaining to testosterone. Now, the first thing is just a discussion about how we should look at blood work overall when we approach testosterone. And that is the philosophy behind it, which is that you don't look to treat numbers. I think the main thing that physicians get wrong is that they're constantly trying to treat numbers where it comes to anything really. It could be thyroid, it could be, they tend to forget the patient in front of them and the symptoms they're coming in with, and rather focusing on the numbers at hand and treating those numbers instead of looking at the patient and what they're saying. So the point is that numbers gives you one piece of the puzzle, but you have to put that together with what you're seeing in front of you as it pertains to the patient. So when you put that whole picture together, for example, you can say you have low testosterone symptoms, but the blood work doesn't really add up. Well, that could mean that some women have low testosterone and they need higher levels for more optimal testosterone functioning. Other women may have no symptoms, however, their levels are quite low, in which case you may, you don't want to treat the number in that case, because if they're otherwise doing fine, they may not need treatment for it. So that's where it gets very personalized and tailored to what the patient needs, as opposed to what you're seeing in the blood work. But that's the philosophy behind the blood work. Now, when you get to blood work, it's important that with women, we do something called an LC/MS assay. An LC/MS assay is a specific way to do the testosterone blood test. And the reason that's important is because if someone's levels are high, and for men, for example, when their levels are several hundreds, 300, 400, 500, then generally speaking, you can accurately measure that on lab. However, when the levels are much lower than that, when you come into the female range, which is around about somewhere between 20 and 70, depending on the lab you will go to. I personally use LabCorp, and so the levels or the range that I would generally see, even though LabCorp has a slightly different range, but around about 20 on the lower side and 70 nanograms per deciliter on the higher side. That is for the total testosterone level. Remember, testosterone is tested in total and free testosterone. The total testosterone is the total amount of circulating testosterone that you have, whereas the free testosterone is the small amount that's unbound to the protein, and that's the amount that's actually bioavailable to do the function of testosterone. So you measure both of these, and the LC/MS assay, or the way to do that blood test, is makes sure that the testosterone level that you're checking in women is going to be accurate when it's at such a low level. So when the levels are low, then you have to ensure that it's going to be very accurate. So to that, then we basically have blood levels, so total testosterone and free testosterone that you want to make sure you check. The total testosterone, like I mentioned, somewhere between 20 and 70. And anytime we talk about a range, we want to make sure we aim towards the upper half of that range for optimization. So it's not good enough to just be at 21, 25, and so on. You want to be higher in on the range. The free testosterone is then also important, and the free testosterone, the ranges you're going to see for that, LabCorp will give you something from 1 all the way to 4, which is the amount of free testosterone. But again, when you have a range from 1 to 4, you always want to focus on the higher end of the range. Now, keep in mind that the levels, the measurement of testosterone and the correlation to symptoms is not a perfect science. In other words, you don't always have symptoms at a certain testosterone level. You can't always, just have one number to aim for. So I think that that's where the individualization and personalization really comes into it, where you have to see, what someone's levels are with the story that they're telling you. But roughly speaking, you want to aim for the range of between 20 and 70 of the total testosterone in the higher end of that, and between 1 and 4 of the free testosterone. Again, if you're doing it from LabCorp, Quest and some other labs will have different ranges, and that's because every lab does it a little bit differently. And then when the free testosterone between 1 and 4, you want to aim for, again, the middle or the higher half of that. And so that's a little background about testosterone testing. I will test women regularly with it depending on their symptoms, but also just to get a baseline level is always good to know. So if you do have symptoms that we discussed that were pertaining to low testosterone, it's always good to have your levels checked, just from the sake of knowing what they are and being able to put them in conjunction with what's going on with you. Now, a quick last point I wanted to mention is that a lot of these societies that you'll see, like ACOG, American College of Gynecology, or NAMS, North American Menopause Society, will have recommendations like, oh, don't test levels in women because we haven't seen levels to correlate with symptoms. Well, okay, that's their opinion. I think that it's not very consistent, because here in men they're saying, okay, measure the levels and it has to be below a certain level, like 300, in order to give therapy and in order to call it low testosterone. Well, in women, now you're saying that, oh, don't test it because we just don't think it's accurate. Well, I think that the truth is somewhere in between, where you can take the test and you can have it be an additional source of information and use that in the whole clinical picture to determine the best treatment course. So I hope that's helpful from the testosterone testing perspective. The next video in the part 3 that we will do is going to pertain to the various treatment options we have once we find someone with low testosterone symptoms and low levels. What treatment options can we take?